A few weeks ago, I did a vlog called What is Autism? And I covered the signs of autism in young children. And one of the things I didn't mention on that video blog was that the length of most waiting lists are huge and so long. And so I wanted to cover today some of the strategies you can use while you're waiting for an evaluation or for more aggressive treatment. Hi, I'm Dr. Mary Barbera, autism mom, board certified behavior analyst, and best-selling author of The Verbal Behavior Approach. Back when my son Lucas started showing signs of autism in 1998, when he started showing signs, and then when he was diagnosed one day before his third birthday in 1999, I was in denial for over a year when my husband first mentioned the possibility of autism when Lucas was just 21 months old. Back in the late 1980s, autism affected about 1 in 500 children. And now the rate is about 1 in 50, give or take. Most studies show 1 in 59, but some studies show 1 in 40, 1 in 29. So we'll just say that the rate of autism went from 1 in 500 2 decades ago to about 1 in 50 now. And once I finally got out of denial about autism back in 1999, it took about 2 to 3 months to get an appointment with a developmental pediatrician at a children's hospital. And then once that developmental pediatrician recommended ABA treatment, it took us another 2 to 3 months to get that intensive ABA treatment to start as well. So in the end, I waited about 4 to 6 months for treatment to start once I got out of denial. Flash forward to now, 20 years from Lucas's diagnosis, and as I said, the rate's about 1 in 50. And because everyone knows someone with autism now, and people know the importance of early intensive therapy to help children reach their fullest potential, autism is not as stigmatizing as it was back in the late 1990s. There's even some knowledge by pediatricians at least and other healthcare workers about the importance of ABA treatment, and even insurance reform has taken place over the past decade so that most insurances in most states have to cover autism treatment, that being ABA, applied behavior analysis treatment. But the wait lists for a developmental pediatrician evaluation are now almost always between 9 months and 2 years in length. That's what I've been hearing from multiple sources across multiple states right within the United States. So waiting 9 months to 2 years for just an evaluation and then additional wait lists to get ABA treatment, which can also be really lengthy. And I feel a little helpless about the wait lists, especially because this is all across the United States. And I just can't imagine, like, if you thought your child might have some type of cancer, if you thought your 2-year-old had some kind of cancer, and you were told that you had to wait 9 months to 2 years to even see if it was cancer, you would be very angry and you would find another way. And a lot of parents are waiting and worrying during this. Even if it's 4 months, it's still 4 months and missing a critical window of time. The sad part is that children are missing this critical window, this really important first few months, first year when they start to show delays. And I did a video blog on recovering from autism. And I didn't realize back in the late 1990s when Lucas was diagnosed, that recovery from autism was even possible. It was proven that it was possible back in the late 1980s by Dr. Ibar Lovaas from UCLA. And now it's still possible, but kids are waiting for a diagnosis, not getting the kind of intensity that could lead to recovery. So what can you do? Psychologists, psychiatrists, neurologists, and some general pediatricians with advanced training can also diagnose autism. So these might be good options to look at as another way to get a diagnosis. I would recommend getting on several wait lists. If the wait list at Children's Hospital is 6 months, 9 months, and the wait list at another, hospital in a nearby state is also 9 months or a year. Apply to both. Fill out the paperwork, even though it's a pain. Fill out the paperwork and get on several wait lists so that you can get in as soon as possible to someone. But while you wait for an evaluation or some more treatment options, there are several things you can do. First of all, you can call your local early intervention provider to get free or low cost multidisciplinary evaluation or services. People like speech and language pathologists, occupational therapists, and teachers. Now, know that this is not usually intensive behavioral treatment, which you're going to need as the most evidence-based treatment for autism. But treatment can get you started. It can give you the evaluations to show the discrepancy between typical milestones and what your child is performing at. So having, like when I took Lucas for an evaluation to see if it was autism, the doctor had then the early intervention reports that showed that his language was at a 9-month-old or 12-month-old, even though he was 3 years old. And it helped him to make the diagnosis easily because he saw these big discrepancies. So I think having early intervention providers in your community do baseline assessments and get started with some therapy can help the situation while you wait. The second thing you can do is you can download a 3-step guide that I created called Turn Autism Around, which includes a 1-page assessment, a 1-page plan, and an easy way to start taking data on a calendar. So when you download the guide at marybarbera.com/join, you'll also have the opportunity to watch a free online workshop and to learn more about joining my online course and community, where we can provide you with more support and more step-by-step guidance of ABA that you can put into place on your own while you wait. And the third thing I would suggest is to really consider joining my online courses and community, even without a diagnosis yet, even if it turns out to just be a speech delay or hyperactivity or learning disabilities. The information you can learn within my online courses and community, easy steps you can take with materials that you might already have in your home, like a shoebox and dollar store flashcards and Mr. Potato Head, and you can learn how to become your child's best teacher and best advocate. And you can get into the captain of the ship mode and to learn how you can navigate the system and get your child the help he or she needs as soon as possible, even while you're waiting for a diagnosis. And even if it turns out not to be autism and your child catches up developmentally and there's no longer needs a diagnosis or loses the diagnosis, my courses and materials can help you while you wait. It just really teaches you how to be a better parent, better teacher, better advocate for kids with all kinds of special needs. And even for typically developing kids, it can't hurt the situation. So I hope that you're more inspired not to just sit and wait and worry, but to actually take action and to learn some of the techniques by getting my free 3-step guide at marybarbera.com/join. If you like this video blog, I hope you'll give me a thumbs up, leave a comment, and share with others who might benefit. And I hope to see you right here next week.